Good afternoon. My name is Claire Saxton with the Cancer Support Community. Welcome to our webinar, Frankly Speaking About Cancer, Coping with Anxiety and Depression, hosted by the Cancer Support Community. If you need technical assistance during the webinar, please dial 1-866-229-3239 and press option 1 for technical assistance. If you would like to listen to today's presentation via telephone, please dial in using the conference line code you see on the screen. Today's call is being recorded and will be available on our website at www.cancersupportcommunity.org/webinars within the next week. The format of today's webinar will be as follows. The panelists will begin the discussion first, and then we will open the discussion up to the audience during the question and answer session. Thank you to those who submitted questions prior to the webinar as part of the registration form. If you would like to ask additional questions, please feel free to type any questions into the Q&A box on the right of your screen. You may submit a question at any time during the event. At the end of this webinar, you will be automatically redirected to the post-webinar survey. Please take a few minutes to complete this survey as your input is of great value to us. I would now like to introduce the Cancer Support Community, which is the largest professionally led nonprofit network of cancer support worldwide. CSC is dedicated to ensuring that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. We offer the highest quality social and emotional support through our affiliate network, as well as online or over the phone. On this screen, you'll see some of the resources we provide at the Cancer Support Community. The first one there is the Cancer Support Helpline, which is staffed by licensed professional counselors who are available to assist you Monday through Friday, 9 a.m. until 9 p.m. Eastern Time. We also have our Open to Options program, which is a research-proven program that can help you prepare a list of questions to share with your doctor. We also have our Frankly Speaking About Cancer program, which is CSC's landmark education series, which provides trusted information on a variety of topics important to people affected by cancer. I would also like to introduce our Cancer Experience Registry, which is a unique project for people affected by cancer. People who have been diagnosed with cancer and those who help care for them can join the registry. You can begin by answering survey questions. Your answers and those of others describe the experience of cancer patients and caregivers. This information is used to provide education and support resources that speak to patients, caregivers, and their needs. For more information or to join, visit www.cancerexperienceregistry.org. I would also like to take a moment to talk about our grassroots movement, which helps ensure that people touched by cancer have access to quality, comprehensive cancer care that includes social and emotional support. Again, if you would like to learn more about this program or to sign up, visit our main website at www.cancersupportcommunity.org. I would now like to introduce our panelists, Dr. Diane Robinson, Stacey Balkanski, and Shari Goldberg. Dr. Diane Robinson is the Program Director of the Cancer Support Community and the Integrative Medicine Department at UF Health Cancer Center at Orlando Health. Dr. Robinson attended University of Central Florida, where she earned both her master's and Ph.D. degrees. Her professional psychology internship was at the VA Medical Center in Gainesville, Florida, with a focus in clinical neuropsychology. She is an adjunct professor at UCF, board member of the Florida Psychology Association Central Chapter, and volunteer faculty member of the UCF Medical School. She is also the current president of the board of the Central Florida Brain Injury Support Group. Stacey Balkanski is currently the program director at Gilda's Club, South Florida, and has been with the organization for 2.5 years. Stacey is a licensed clinical social worker and has worked in both for-profit and nonprofit settings over the past 20 years. Most recently, Stacey was the owner of her own psychotherapy practice with a focus on chronically ill patients, including cancer patients. Shari Goldberg is a small cell lung cancer survivor of nearly 2.5 years. After retiring from a sales career in 2014, Shari and her husband retired to South Florida to be near their grandchildren. While biking with her family, she took a fall and thought she had broken a rib. Come to find out, she had small cell lung cancer. She finds support at her local Gilda's Club in Fort Lauderdale. And before we get started, I just want to emphasize that although some of our speakers will talk specifically about lung cancer, the information about anxiety and depression is applicable to anyone affected by any cancer. I'm now going to ask Dr. Diane Robinson to share her expertise and perspective as a psychologist and talk to us about coping with anxiety and depression associated with a cancer diagnosis.
Thank you so much, and as you shared, a lot of this information, just the few first slides, will be specifically about lung cancer. But really all of this information is applicable to any type of cancer and almost any type of other major illness that someone may find themselves in. So with lung cancer, what we know is there's about 250,000 Americans impacted every year, new cases coming on board. And that's a huge amount of folks. And it is one of the most difficult diagnoses to find and to cope with, and we'll talk a little bit about why later on. But it is a disease of aging, and most cancers are applicable as well in that category. In other words, it's much more common to find people who are over the age of 65, 70 getting this diagnosis. So it's much less common in younger people. It is the second most common cancer for males and females. Of course, the most common one in males is prostate cancer, and in females it's breast cancer. But it is very much the number 2 in both genders. So let's have the next slide. Information about cancer you'll find if you go online, and I'm sure many of you who are listening in today have done this, and you enter in your diagnosis, the thing that you're interested in, you're going to get bombarded. There's literally thousands of websites telling you different information, and it can be quite overwhelming. So what I always recommend is go to the places that you know the information is going to be accurate. And so obviously I recommend the Cancer Support Community as one of the best places to go. The reason why I recommend them so much is that the information is not only accurate, but it's presented in a way that you can actually understand. It's written in English. So I really appreciate that about them, and having such great information available to anywhere, no matter who you are and where you are, you can access that information as long as you've got an internet connection. The webinars are really useful, and you can go back and listen to this again, and also find other really great webinars on various topics on their website as well. Next slide, please. So let's talk about this. When you think about your cancer diagnosis, and sometimes, you know, you're in the middle of it, you're coming out of it, or it's all very brand new, when you start sort of looking at this long list of side effects that we put up there, anybody, no matter who you are, can understand it's overwhelming. And what is interesting is that what might impact you the most is not necessarily the same that's going to impact someone else. So one of my patients may have really chronic neuropathy, but someone else may never be able to let go of that nausea. It's there constantly. And part of this is to understand that even though medicine is a science, it's still an art. Simply because you're such an individual, we don't know exactly how you're going to respond to certain medications. It's still the mysterious part of medicine. So we don't know how it's going to impact you. We know in general terms. So most of those side effects are short-term, and they are to do with reacting to that chemotherapy, that radiation that you may be going through, or some of the other targeted treatments, the surgical treatments that you're going through. But it impacts you. And remember I said it just looks overwhelming. Even me looking at this slide, I'm like, oh, too much information, right? So that initial impression that as we're looking at it, if you're experiencing it, you're in the middle of this. So it's kind of normal that those physical side effects that you're getting not only from the disease process, the cancer process itself, but the treatments are going to start impacting your emotions. This is really obvious. This is so clear to all of us that there's going to be some emotional impact. What we're trying to discuss here with you today is how much is normal and how much is going to be normal for you. Next slide, please. So there's some really common emotions that almost everyone reports when they're going through a cancer diagnosis and treatment. So the first one is obviously anger. A lot of why me, why now, kind of dealing with that, dealing with sadness. There's a certain amount of grief that comes with that idea of loss of hope and control, that suddenly your body isn't really yours, it's somehow betrayed you. That's a very common one we get when we talk to patients. The other thing is that there might be things that are going on due to surgery where your body itself is changing. And obviously overhanging everything is the question that we ask and get asked all the time is, am I going to die? Is this going to be now? And obviously the answer is we're all going to die. It's just the question of when. And those emotional side effects of the treatment are very, very common. So they can be most intense right at the beginning of treatment. But it can go up and down, and I've had it described to me as a roller coaster. Like one day you're coping fine, you're on top of everything, and then the next day you can barely move. The overwhelming emotions that just seem to be pressing down on you. One thing that really can impact this is how your family are reacting. How's everyone around you doing? And what we know is that even though there's one person in the family that has cancer, really everyone does, because it's impacting just every aspect of your life, your relationships, your family, even your neighbors. Everyone seems to be taking part of this on. And it's not just about relationships as well, it's every aspect of your life. You may find now that you have financial difficulties, you can't work anymore, and those are adding to the worries and all of the other emotions that you're experiencing. Plus you're trying to help other people cope where you don't necessarily have your own coping mechanisms in place. So it starts to have some pretty impactful, social and emotional side effects that can be, again, overwhelming, just as overwhelming as that list of the physical. The list of emotional and social impacts can be equally as great. Next slide. So just looking specifically at lung cancer, with that diagnosis there becomes often more severe physical. If you just think about the lungs as part of your system, that's where you're taking in your oxygen, that's where you're getting the energy for your blood to power all your muscles. And so as soon as something starts to impact the lungs, then we're going to have an impact all the way through your physical system because you're just not getting enough oxygen in, and therefore you're not getting enough energy. So things like muscle weakness is very, very common, and that starts again to impact your quality of life. Now, with regards to depression and lung cancer, and when we talk about depression today, we're going to talk about two different levels. One is symptoms of depression, but the other is the actual diagnosis of major depressive disorder. And so that's when it goes on to not just experiencing feeling a little bit down, but having a clinical diagnosis. That's approximately 15 to 25% of cancer patients. And what we know is having a cancer diagnosis will actually double the amount of people who are diagnosed with a clinical depression. So in other words, we find clinical depression twice as much in cancer patients as we do in the general population. And also that once someone becomes depressed, it starts to impact the children, the people around them. So then those negative consequences start to build up. And anytime there's a study that we put up there on the slide that talks about a study that came in from England looking at women with breast cancer, and depression was actually the strongest predictor of their children really not coping well with the cancer diagnosis and acting out. So it's really important to understand what depression is and how we can help you cope with it. So diagnosing depression, remember, this is not just normal sadness. Sadness is one of those emotions that you're going to experience. Almost everyone who has a diagnosis of cancer does. It's a different level. And you need to be diagnosed by a professional. What they're going to look at is a series of symptoms. And they're going to basically see, have you got 5 or more of these symptoms? So there's 2 that have to include. One is either having a depressed mood most of the day, most of the week, or the other one is a complete loss of interest or pleasure. Now, if you want to think about it in very practical terms, a patient asked me to describe, well, what does that mean? Well, for example, when you go home and you're really tired, and fatigue is so very common with any cancer diagnosis. It's one of the main side effects and symptoms. But you're really tired and you're sitting in your chair, and say your dog comes in and your dog bounds up and gives you this huge lick. No matter how tired you are, it can bring an inner smile. You can just go, and pat him on the head, and there's something that you feel very connected to. Folks who are depressed, that kind of interaction, even one that normally brings them simple joy, no matter what the situation, that disappears. So that's one really good indicator we have of things that normally would just lift your spirit a little bit. That's having no impact at all on you, and that's that loss of interest and pleasure. So the rest of them, as I said, we need to have 5 of those symptoms to get a diagnosis of major depression. Now, one thing that I try to talk to our patients about is that there's this idea that, well, I've got cancer. Aren't I supposed to be depressed? Isn't this normal? Doesn't everyone get depressed? And the answer is no. Having a really diagnosis of depression is not normal, and there is something you can do about it. So in other words, this idea of sort of resigning yourself, well, this is just how I'm going to feel, and this is the way it's going to be. You may have a little bit more options there than you thought, and it does hold people back. When I talk to them in our clinics here, they don't really want to share it with their physician because they just think that's supposed to be. And so part of what I really want to impress on everyone is just talk to your clinic team, talk to your physician, talk to anyone that you're dealing with that maybe you're concerned about your mood. Don't be in any way embarrassed about it, because there are things that you can do about it. So let's have a look at the next slide. So anxiety it's going to occur in varying degrees. In other words, almost anyone who has this diagnosis, you're going to worry. Anxiety is worry. When we get to worry that's out of control, then we start diagnosing. So from all of the different literature that we can look at when it comes to anxiety, about 44% of patients across the board, across diagnosis, report some type of anxiety, and 23% had pretty significant anxiety. But the actual diagnosable psychological disorders of anxiety are a lot less common in cancer patients. So even though that feeling of worry is pretty constant, it's not as diagnosable as the depression, for example. So in other words, you don't see these things like general anxiety disorder or phobias or panic disorders as often as you would maybe depression. If anxiety is interfering with treatment, sometimes we'll give folks an initial diagnosis of something called adjustment disorder. So in other words, it's temporary, it's something that's just happening to you right now, and we know that as the treatment moves on, you're most likely going to adjust. Part of the problem with diagnosing anxiety and depression is that a lot of the physical side effects of either the treatment or the disease themselves can actually look very much like depression or anxiety. So if you look at that list of things that we use to, kind of like a checklist, is there someone clinically depressed or not? Well, sometimes the disease itself can cause fatigue or can cause loss of weight, which are symptoms of depression. But also medications can have a strong impact as well. So quite often folks are given prescribed corticosteroids, interleukins if they're the blood cancers. So there's various medications and can actually suppress your system and change the system where you're actually looking like someone who's clinically depressed. And so then it really takes careful conversations with your oncologist or your nurse practitioner, whoever you're seeing most, to kind of really understand what is this? Is this depression or is this a reaction to medication? Next slide. So for the most part, most oncologists will look at how you're feeling, will talk to you about your emotions, and their first line of defense oftentimes is the medication. So there's certain medications, and what they do is work on the system of chemical signaling that goes on in your brain. So in our brain, we have certain things called neurotransmitters, and these are literally chemical signals that we release to make our neurons have certain actions. So some of these are called serotonin, norepinephrine, noradrenaline, all kinds of different things that signal pathways in your brain. What we know is that the medications that have been most effective with depression are the ones that keep certain neurotransmitters in your brain just a little bit longer. So we have serotonin, selective serotonin, we have norepinephrine. All of these neurotransmitters stay a little bit longer in your brain. So the most common medications that are prescribed are the SSRIs, and you may know them under the names of things like Prozac or Lexapro. And then we have some other ones that we can give, stimulants, which I think most people know the famous Ritalin that was given years ago for ADHD, one of the most talked about medications we've had out there a long time. But we actually will prescribe that sometimes to help folks increase their energy levels and even focus their attention a little bit more to be able to get out and about. So those are two that are quite prescribed. One thing that is difficult about any of these antidepressant medications is they do take a while to kick in. Oftentimes, someone won't see effects until 2 weeks, but it can be even much longer than that, up to 6 weeks. So we try to begin with a very low dose and titrate it up. That means just keep adding a dose until we find a level that seems to work for someone. The reason why we do this, or our clinicians here do it, the oncologist, is that we don't want to, we want to monitor if there's going to be any serious side effects with you and how you react to that medication. Because remember, I commented that we really don't know how you're going to react. We know in general that these are very well-tolerated medications, but we just don't know for you as an individual. So that's why they always start low and start slow and gradually build it up. Next slide. With anxiety, we don't have, physicians don't have quite as many choices. There's a class of anti-anxiety medications that we call benzodiazepine, but you're more likely to hear them as Xanax and Valium. They've been around a very long time, and they are really effective at controlling anxiety. They work quickly, they get into your system fast, and they have some immediate relief. They're normally used short-term. we try to encourage the physicians to use them less than 4 months. But when it comes to cancer, what we want to do is make sure that you're emotionally being treated. So sometimes we'll have much longer periods of time where someone is being given some of these medications simply because we want you to get through the cancer. So let's deal with the cancer first, and then afterwards, if there's any potential issues with that medication, we'll deal with them then. It's more important that you're feeling that your feelings and your emotions are more under control, and that you're having the best quality of life possible as you go through this this cancer treatment and diagnosis time. So next slide. In terms of psychological interventions, they have the same impact as medication. So if we put them side by side, we'll find that if you put Prozac up against something called cognitive behavioral therapy, eventually they're going to have the same level of impact and do as much good as one another. So all of these ones that we have strong research for as psychologists, those are our go-to ones. Just like a physician would prescribe you Prozac, the most common prescription that I would give as a psychologist would be cognitive behavioral therapy. We know this is extremely effective. It's just trying to help someone deal with all of the different thoughts and gradually help them have a coping strategy for the depression that they can actually have for the rest of their lives. So in other words, with medication, the medication works while you're taking it, but as soon as you stop, then, there's nothing there in your system. But if we start to teach you how to cope, then you have that strategy there for the rest of your life. So all of these different therapies really work on helping you understand what's been driving the depression and understand some of those thoughts. And one thing I always like to tell people is that thoughts and feelings, they're not some airy-fairy little clouds that are floating around. They're actual chemical and electrical events that are in your brain. And if we can help you start to think about things in a different way, you actually start to change those chemicals yourself within your brain. Instead of using a medicine, we actually can help you do that yourself. So these are pretty effective treatments. And if you click on the next slide, you'll see some even more ones. There's a lot of different treatments out there with a good provider. Sometimes you'll have clinical social workers who can do these kinds of interventions with you, licensed mental health practitioners. So there's a lot of folks out there with tools to help you. You don't have to feel that there's nothing that can be done. These are very effective treatments for depression. Next slide. So just like with depression, with anxiety, we've got some really strong evidence-based treatments as well. And again, they tend to be the cognitive and behavioral therapies. And if someone has a specific phobia, we do something called exposure treatment. The other thing that comes with some of the anxiety that you experience with a cancer diagnosis, often there's some of those symptoms that almost look like post-traumatic stress disorder. So we will start using some of the therapies there if someone starts to have those sort of panic symptoms that are associated within that. We will work on those and what's been triggering them. Next slide. So for me, the best way of treating depression that's clinical and clinical anxiety is actually to start at the root point. If we can get you help before you develop and get diagnosed with a clinical psychological disorder, it's much more easy to treat. So step one is really beginning to look at the stress of the disorder. And I'm going to switch, take the slides on now. I think Stacey is going to take over, and she's really going to talk much more in depth about this idea is you can start looking at this as a very stressful chronic event, but treating that stress and not letting stress get hold of you, you're much less likely to develop a more serious emotional and psychological disorder. So I'm going to hand over the slides now over to Stacey.
Thank you, Diane. And good afternoon, everybody. This is Stacey Balkanski. I'm glad to be with you today. If we could go back to that last slide for a second, I think this is a really good place to start because if you look at what the symptoms are of chronic stress, we see sleep, appetite, low energy, low sex drive. All of those things are evidence that your body's going through a major stressor and also can be side effects of cancer treatments. And so it's really important not to keep these feelings to yourself and, as Diane mentioned, to share them with your care team so that it can be determined whether or not you're having a reaction which is considered a chronic stressor or a major anxiety disorder, or if these are side effects of your care and they can be managed from that perspective. So I just wanted to draw that parallel. So on to the next slide. I'm starting almost at the end here, but this is something that we hear so often in our support groups is when is everything going to get back to normal? I just want to get through my treatment so I can go back to my life. And I think we even had a question submitted with regard to when does that happen? And I think it's important to go into it knowing that the expectation is that you're going to have a new normal because you've had a new experience. Saying that cancer is a new experience is obviously the understatement of the year. But, anything that changes in our life changes how we live our lives. And so, expecting that, once you've finished your treatment, that you're going to be returning to life as you knew it is probably not realistic, but it doesn't mean you won't return to a good life. So I want to just put that out there, and I hope that when Shari comes on later on, that she'll talk about what has changed in her life, because a lot has from her pre-cancer diagnosis to now, but what she finds in her life that's fulfilling now. Next slide, please. So coping mechanisms, that's something that we talk about a lot here at Gilda's Club. And I say Gilda's Club because my organization is a Gilda's Club, but Gilda's Club and the cancer support community can be used interchangeably because we are all part of one organization. So some of us have great coping mechanisms. We're just we either, grew up and we learned wonderful coping mechanisms throughout our lives, or, we've been through situations that have helped us to gain strong coping mechanisms. But, with cancer, that's a real test to your ability to cope. And so just to define what a coping mechanism is for anybody out there who's not familiar with that term, it's really just the way people deal with their emotions. Some people are really good at it. Some people are not as good at it, or maybe just are not equipped for this situation of a cancer diagnosis. Every person uses different ways to manage their stress. Some of us exercise, some of us knit, read, watch movies, all different ways to manage stress, but helpful for each of us in our life and what we're going through. But when we're talking about cancer, we're talking about managing another level of emotion, another level of, as Diane mentioned, sadness, depression, worry or anxiety, and other negative emotions that we're probably not used to coping with. So this is a real challenge. It's a challenge to your ability to accept this kind of a change into your life, to lose control to to some extent, to a large extent really, of your health, of your body, of your care, of your routine. There's so many challenges. So you might find that your coping skills are working really well, or you might find that they're not working so well. Next slide, please. So there's some real positive ways to learn to cope with stress and depression. And in general, we always say, and I'm a therapist, so you have to forgive me, but we always feel that talking about things is much better than not talking about them. And at Gilda's clubs and cancer support communities, we provide an opportunity. We create communities of people who can come together and share what they're going through with each other, and talk to other people who get it, okay, who are going through what you're going through, who may have experienced what you've experienced, who can maybe answer your questions or you can answer their questions. And that's a really healthy way to deal with sadness and stress or anxiety. We have here at Gilda's Club many opportunities to gain social and emotional support. And for those of you who are familiar with our organizations, we also provide social and emotional support for our family members, family and friends, caregivers, children. And that's really important because, as we heard earlier, cancer is a disease of the whole family. And so we want to help everybody in the family deal with this problem, get the sympathy and emotional support that they need, become aware of their feelings, because sometimes we feel things, but we don't have a name to put to them. And so that's something that we can gain by being part of cancer support communities is, hearing through other people's stories. We can then put a name to what we're going through, and vice versa for the people that you're sharing with. Next slide, please. So the opposite of getting support and talking about your feelings is denial. And everybody's probably familiar with denial. Denial is trying to forget that the problem exists. So maybe denying that you have cancer, denying that your family member is ill, or that they're changing as a result of their diagnosis, their treatment, trying to avoid thinking about the problem. Again, the opposite of expressing your feelings, just ignoring. Some really negative ways of coping would be people who are turning to drugs or alcohol to try to forget the problem. It's not that that's not an understandable mechanism. It's just not helpful. It's, for all of the reasons that you all already know. It's not dealing with the problem, and by burying it, it just becomes worse and worse. And then you get to that clinical depression, that clinical anxiety that requires a more intense intervention like medication or therapy, as opposed to just the kind of support that you would get at Gilda's Club. Next slide, please. So here we see that social support lessens anxiety and depression. So why is that? Have you ever found yourself, just having a really bad day, and then you meet up with a friend after work or after whatever your day consists of, and you meet somebody for dinner or a drink or a cup of coffee, and all of a sudden your mood completely changes, because whatever was holding you down for that day is lifted by being around other people that understand you. And that's what social support or support groups, healthy lifestyle groups, which are things like yoga, book clubs, um, all of the different offerings that we have, educational workshops, social events. So all of those things lessen anxiety and depression because you're able to kind of get out of that thinking. And even if you're talking about your cancer, you're talking about it. You're letting it out of yourself, and you're letting it, some of that heaviness lift. So it's very, very important to determine what your social support system looks like. Sometimes we have very, very supportive spouses or children, other family members and friends. But if they don't have cancer or haven't had cancer, they won't necessarily know what you're going through specifically. They can care, they can help, but they might not be able to really understand what you're saying, and that can become really frustrating for both of you. And so that's why we really encourage the whole family to seek social support and psychosocial support. And this really helps to reduce stress and distress within the individual and the family. Next slide, please. So how do we find healthy ways to cope other than support groups? Okay, so I've talked a good bit about that. How do we determine, well, I'm now no longer able to go to spinning. So I can be really sad about that. I can become depressed about that. Or I can try to figure out something else that I can do to replace that. And I think that cancer and living with cancer has a lot to do with flexibility around those things and finding new interests, finding things that you're able to do based on your new physical and emotional circumstances. Sometimes those things are just time limited based on treatment. Sometimes they're more long-term. But if you were an avid exerciser and now find it difficult walking, you can make yourself really, really unhappy by just, kind of living in the past and focusing on what you can't do, or you can look at things that you can do. And, when all else fails, Googling the word hobbies is not the worst thing in the world, okay, because you'll get lists of things to try. But, you know yourselves. Think about the things that are interesting to you, something that maybe you always wanted to try. If you weren't a big reader before, maybe now is the time that you want to try reading. Crossword puzzles and all the cognitive games and resources that are out there are wonderful for helping with chemo brain. And also passing the time. Whatever you can do next to sitting on the couch and watching TV, finding those new interests will really help you find new ways to cope, reduce your stress, and also reduce your sadness. Next slide. So I wanted to talk to you. I've already mentioned a little bit about what cancer support communities and Gilda's clubs have to offer. And for those of you who don't have one in your local community, these are things that you can look for in a variety of other settings. Most major hospitals offer support groups. And also community organizations, the American Cancer Society. Those resources are very, very available. And if you talk to the social worker at the organization where you're getting treated, they can often make those referrals for you. But at Gilda's Clubs, we offer support groups for people with a cancer diagnosis, as I mentioned, friends and family or caregivers, and also for the children of people with a diagnosis. And all three are support groups that are facilitated by licensed mental health counselors, licensed mental health professionals, let me say. And the reason for that is just because it is important to have somebody on hand if major anxiety or major depression or any other kind of a mental health issue becomes evident within the structure of the group. But we believe at Gilda's Club that the members are the experts. So when you come here, you're not going to find a group facilitator or a staff member who's going to tell you about your cancer. We want to create an environment where you talk to each other and you interact with each other. And we're the people the staff are the people that you wave at when you come in and you say hello to, but you're really coming together to be with one another, to have a meal together and share what happened in your week or a question that came up or a fear that suddenly occurred to you. And that's those are some of the real benefits that we see in support groups. We know for sure that people who receive psychosocial support have a reduced risk of cancer recurring. So that's a really good reason to seek out support. And everything that cancer support communities and Gilda's Club offer are all free of charge. And that means everything. So no matter what your financial situation, how wealthy or how not wealthy you are eligible for our services. So never let that be a barrier. The same goes for the healthy lifestyle offerings. As I mentioned earlier, we here in Fort Lauderdale we offer yoga, book club, Reiki, meditation, writing class, watercolors class, and really the offerings are driven by the needs of our members. If the members are interested in learning how to knit, we will find a teacher to come in and provide that. So as everything is within cancer support communities, they're member driven. And we use the word member loosely. Again, it's because there is no charge, but you are a member of a group of people that are going through what you're going through. Next slide, please. I'm going to actually move on to the next slide as well because I talked a good bit already about support groups. So I'm hoping that at the end of our talk today, that you all will have some questions about what it's like to be in a group, because it's sort of the last thing that most people ever want to do. You go to your doctor, you see your oncologist, you get a cancer diagnosis, and they give you a brochure to go to Gilda's Club, go to the cancer support community. And most people are pretty reluctant or resistant to that idea at first because they're not group people. And if you could see me, I'd be using air quotes. We hear that a lot. I don't know. I'm not a group person, or my husband isn't a group person. I don't know if he'll go. And generally speaking, the people that are the most resistant do the most talking in group. And I believe that the reason that is because people that feel like they're not group people tend to be more introverted, and so they keep more to themselves. And when all of a sudden, when they're in an environment where they have the opportunity to share their feelings, it all comes out. And so, don't let that stop you from trying a group. I always say to attend any group that you're going to try 3 times. And why 3 times? Because the topics and the mix of people and the discussion are going to be very different each time because, again, we don't have an agenda. So in order to really know if it is for you or if it isn't for you, the only way to know is to give it a true shot, and I think 3 times is fair. And what we find here in Fort Lauderdale is that some amazing friendships have been formed here. Many of our group members are on a group text where, they check on each other during the week. They know when each other are going to be having tests or surgeries, and they're always checking up on each other, offering to help in whatever way they can. We had many couples that attend, one in the wellness group, which is for people with a diagnosis, and one in the caregivers group. And the couples end up going out, for dinner or, after group for something to eat. And so, it's not your first choice for sure of where to make friends, but it does happen. And it's because you have so much in common with these people, just like any other friendship that you would form. Next slide. As I mentioned, healthy lifestyle groups are, they're meant to take your mind off of cancer. It's sort of an opportunity to get away from cancer and be strengthened through some kind of action. We know that stress reduces and weakens the immune system, and so we want to try and boost the immune system as well as promote healing through our healthy lifestyle offerings. So as I said, the classes that are offered are open to both patients and caregivers, and a healthy lifestyle group is really very key to managing anxiety and depression, and we really encourage members to be active in this setting. It can be very difficult if you're going through chemo and maybe you've lost your hair and you feel like you want to wear a wig everywhere you go, or you need to get dressed and put on makeup and draw on your eyebrows, in order to go out. At Gilda's, you come as you are. So if you want to take a yoga class, you don't need to put your wig on. It's very uncomfortable to exercise with a wig. You can come here in whatever state you're in, and you're accepted that just as you are, and that goes for anything that happens here within our clubhouses. And it's really important to have some place to go that you can be who you are in that moment. We do many social events as well. Next slide, please. So we offer social events, which for the same reason, because we hear from our members that socializing, that they miss laughing. Everything is so serious. For good reason, but it's important to be able to laugh and to be able to have a meal with friends. And so we try to create those opportunities by offering social opportunities within the clubhouse. And as you can see on the slide, we try to really offer a range of things. We do potlucks and movie nights and game nights and holiday events, all to, again, create a sense of community where everyone can engage with each other. And it's really important to have that social outlet. In reflecting, before you had cancer, there were times in your life maybe that you moved to a new city or went away to college and you didn't know anybody, if you can remember how lonely that felt and how sad you were, this is the opportunity to turn that around, because cancer is extremely isolating. And so we want to take that situation and flip it on its head and give you the opportunity to get away from the isolation of cancer, reduce the sadness, reduce the stress, reduce the depression by having fun. Next slide, please. And also we offer educational workshops. This is a really important component as well of what we offer in cancer support communities. educational workshops are opportunities for you to come and have in a small setting the opportunity to speak with medical providers. So let's say your issue is lung cancer, like we're talking about today. We could have a lung cancer doctor come to the clubhouse and talk about what's going on in lung cancer, what are the new treatments. We do extensive Q&As, so many times it ends up being just, a small group of people sitting in a circle with the doctor getting all their questions answered. And where else are you going to have that chance? And members have all kinds of issues and concerns. We've brought in financial experts, people to talk about wills and trusts, nutritionists. Some of our biggest workshops have been on nutrition and food preparation. And of course, the big topic of the day, cannabis. We've had a great response to our cannabis workshops. And these are great opportunities that are free, again, to everybody, including the community. The educational workshops are open to everyone, members and non-members alike. And we usually do those 2 to 3 times a month. And again, they're driven by the needs of our members. So if there's something that somebody's particularly interested in, we will find somebody to come and talk about that. And as you see on the slide, knowledge is power. What we don't know is what scares us the most many times. Sometimes knowing can be very scary, but not knowing is generally even scarier. And what we don't know, we will fill in the blanks. So these are chances to get the information from experts, medical experts and other experts. And, again, the more you know, the less your anxiety, less anxious and less depressed you'll find yourself. Next slide, please. So the fifth thing that we offer in the final offering is resources and referrals. As the quote says on the slide, studies repeatedly show that cancer patients wish they knew where to find help with financial concerns, medication, health, and mental health-related questions, and other issues when they were going through treatment. And Gilda's clubs and cancer support communities are here for that reason. Some of that is done informally through support groups and healthy lifestyles, social settings, member to member, and some of it is done in educational workshops like we just talked about. But we can provide you with targeted resources and referrals to meet your needs that fall outside of our purview. Next slide, please. So in summary, what will you find when you walk up to a Gilda's Club? You're going to find the absolute opposite of the hospital setting. We are very home-like settings. Gilda's Club Fort Lauderdale is actually in a historic home. We're on the historic register. And when you walk in, you find big overstuffed couches and comfortable chairs, and we have folks that knit blankets for us. So if you get cold because of your treatment, we can manage that. We have a community kitchen where you can bring your own food or you can share in the food that's provided. Our staff is very friendly and understanding and supportive. And extremely helpful. You'll find that the facilitators are really interested in you and in meeting your needs. And the whole goal is to create a home away from home for you to get all of your social and emotional needs met in a group setting with other people who are going through what you're going through. And our goal is that no one faces cancer alone, and we are here to help you with that. I thank everybody for listening. I'm going to go ahead and hand over our talk now to Shari Goldberg, and thank you all.
Thanks, Stacey. Hello, everybody. I'm delighted to be with you today. Can I have the slide? Okay. My journey started in early July of 2014. I moved to Florida to be close to my grandchildren, and I bought a bike so I can go bike riding with them. My first time on the bike, I took a fall, and I thought I might have broken a rib. And I lived with the pain for a couple of days and then went into the ER. And as soon as they took the x-ray, the nurse showed it to me, and I knew I could actually see something on my lung. They did a PET scan, and it confirmed the cancer, and I was diagnosed with small cell lung cancer. I spent 3 weeks in the hospital. I had a thoracotomy. They couldn't reach the cancer through my lungs, through my mouth, or through my throat. And I was in the hospital for 3 weeks, feeling like hell, very depressed. First chemotherapy that I had was with an oncologist who told me that if I didn't get started right away, I'd be dead in 13 weeks. My son-in-law immediately found another doctor for me to see. I had chemotherapy 3 days a week, radiation 5 days a week for 6 weeks. Then I went through brain radiation to prevent any kind of metastases. The therapy worked. The chemo was wonderful, although it exhausted me. But I went into remission, and I was in remission for close to 8 months. Then the cancer came back. So I went through another round of chemo with a new drug. Right now, the cancer is stable. Next slide, please. When I was first diagnosed, the depression, of course, was overwhelming. I put myself to bed. I didn't want to get out. I didn't want to talk to anyone or see anybody. My husband only let me get away with that for a short time. He gave me time to grieve, then made me pull out of it. My oldest daughter moved her family down to Florida to help with my care, which was amazing. I have a daughter who lives very close by, who has 2 grandchildren. My oldest daughter has 3, so I had all 5 of them close by. They would come over to snap me out of my reverie. They would tell me stories, sing songs, talk to me. Next slide, please. One of the things I have to stress is you can't be depressed with your grandchildren around. What I started to do is find activities that I can kind of get lost in. I started buying coloring books and colored pencils from Amazon. Colored lots, days and days of coloring. I do jigsaw puzzles on my iPad. I used to read a lot, but I find now that I don't concentrate, so I've given up reading for a period of time. I also love to play mahjong, and I try to get that done once a week. My group at Gilda's has been a godsend to me. A support group is so important. I have met such wonderful people. The only negative that I can say is that sometimes you lose your friends, and that's just something my husband pointed out to me, and I've had to deal with. I've lost 3 friends from my group in 2.5 years that I've been a member. But you can talk about anything, no matter how you feel. There are people there who they're sympathetic because they get it. They've gone through it. When you talk about the fatigue from chemo, they've all done it, and they know what it feels like. So we're all there to support each other, no matter what we have to do. Thank you. Okay, now, I have no chemotherapy currently, but I will have a PET scan in January, and we'll see what it says. If the cancer has returned, I will either have chemo again, a apply for a clinical trial or continue. If it's stable, I'll continue without treatment. I have anxiety that the cancer is spreading inside me because I haven't had chemo since the end of July. Every time I have an ache or a pain, I think it's metastasizing. I do plan to bring this up in my support group for ideas from my fellow warriors on how to cope with these fears. Thank you.
We would now like to open the discussion up to the audience. We may have answered some of your questions during the presentation. However, if you have any additional questions, please feel free to type them into the Q&A box to the right of your screen now. The first question that we have, I'm going to ask Stacey to answer first. If someone has access to a Gilda's Club or cancer support community or other support groups, when should they think about talking to someone about depression and if they actually need treatment for depression, separate from a support group or any of the other activities that you talked about?
Well, that's a really important question, and thank you for asking that. Support groups aren't meant to address everything. And in order to become a member at Gilda's Clubs, we do a new member meeting where we invite you to come in and give you a tour, and we offer what's called a distress screening, which attempts to measure the levels of anxiety and depression in any individual as they come through our doors. And so it might come up just in that initial meeting that you're struggling with depression or anxiety in a level that would warrant additional care. But if you're wondering, at what point is a good time to bring it up, any point is a good time to bring it up, whenever you feel comfortable. And the sooner the better, because ultimately you want to feel better. And, so the sooner that you share those feelings with a staff member, the sooner that we can get you to care, and you'll start to feel better.
Dr. Robinson, do you have anything to add to that?
No, I just want to echo what Stacey said. Having changes in mood and being sad and sometimes angry, that's a normal part of having this experience of having something as serious as a cancer diagnosis. But it doesn't mean to say that you have to have that day in, day out, that you have to be clinically depressed. That's not part of, what cancer is. So definitely talk to your clinical team as quickly as possible. If you think that this is persisting, that it's normal, they want to hear from you. They don't, want you not to say anything at all, because ultimately if you are depressed or anxious in a clinical way, we know it's going to impact your treatment. So they absolutely want to know. So just like Stacey said, bring it up as quickly as possible if you suspect that this is something, more serious.
Great. The follow-up question to that is, how do I find a counselor if I don't want to bring it up to my healthcare team? Dr. Robinson, do you want to?
Yeah, I always say, in this day and age, the first place you have to start is with your insurance. Just reach out to them, see what's covered and who is covered by the plan. A lot of times you might have a friend recommend someone, but they're not on your plan, and so then the out-of-pocket expense is really going to seem overwhelming. And a lot of those treatments that are used are the same ones that if anyone's depressed, because it works in the same way. Cognitive behavioral therapy would be similar to someone who has depression outside of cancer as someone who has cancer. So definitely start with your insurance. Talk to your clinical providers. If you don't want to talk to them about seeing someone right there, oftentimes they may know of other organizations. For example, the American Cancer Society has a really great database of different providers and maybe foundations that help out folks, and that varies by region to region, but that's another place to reach out to see if someone might be able to cover expenses in that nature for some psychological support.
Great. Stacey, do you have anything to add?
Something that we do hear from our members often is that when they go through their insurance and they're referred to a provider, that the provider's lack of knowledge of cancer and chemotherapy and the various treatments, it really inhibits their ability to connect with the provider and for the provider to be helpful. So although I agree with Diane that the treatments are generally the same, there's no special care model for a cancer patient, sometimes having a therapist with an oncology background can be very helpful. Some of the local universities often have psychology programs, social work programs, and and so that might be a potential resource. I know that our local hospitals have students that specialize in oncology and are really wonderful with working with members. And I guess the most important thing is if you don't connect with a therapist, don't give up. Try another therapist.
Thank you. So our next question is, after being ill for so long and having a bad prognosis, it seems like people are falling away. I try to be upbeat and positive, but I feel I'm coping better than some of my friends and family. They don't want to talk about it, and they don't want me to talk. Stacey, do you want to comment on friends and family being in denial and not wanting to talk about it?
Yes, I saw that question that it was submitted earlier before the webinar, and I thought that it was also a great question. Friends and family caregivers are also trying to cope with major changes in their lives. Whatever changes are happening with the cancer patient are also happening to the family, as we talked about earlier. And so it's really important, that they also seek out support from others that understand what they're going through. Our caregiver support group is really, really tight. And it's because nobody else really understands what it means to have a spouse with possibly, a terminal diagnosis, or what it means to live with somebody who's having side effects from treatment like chemo brain, or major insomnia, incredible fatigue that prevents them from leaving the house. So, the adjustment, just as the diagnosis adjustment disorder can be given to a cancer patient, it can also be given to a caregiver because it's a significant change in their lives.
Thank you, Stacey. Dr. Robinson, do you have any additional perspective on this?
Yeah, I think part of it is there's always an elephant in the room. As a nation in general, we don't like to talk about the possibility that we're going to die. It's just something that we're not in a habit of having that conversation. And so part of it is trying to have that conversation early in the illness, and there's some great tools out there. There's one that's actually called the Conversation Project, where you can start talking about wishes, and this is something I encourage everyone to do, whether you have a cancer diagnosis or not. So I encourage all of my team members to do this, just to get used to having that talk and understanding that, if we can talk now while everyone is is still clear of mind. There's not so many of the heavier emotions involved. We can actually save ourselves in the end of having some really painful times for ourselves and our family. So I'd say start talking early about wishes, about possibilities, about eventualities, and it does make it a lot easier in the long run. So again, my 22-year-olds who are just starting here with us at the hospital, I tell them have the conversation, and they have to go and do the 5 wishes and the conversation project just to have some clarity and understanding that it's healthy to talk about, as human beings, it's part of our life, death is part of our life. So let's do those conversations earlier, and it does save some heartache in the end. When you are there in the end, I will tell you, your question touched me because we do see that a lot in the hospital where actually the patient has some peace. You've kind of worked through it. You're at a place where you're understanding your journey in a sense, or you're where you're at emotionally, but then you have this tremendous amount of pain because the family is going off in all different directions and having all different opinions, and it just becomes quite painful. So what we encourage, again, is to have family conversations right here with all of the providers, bring folks in, have, the daughter that lives far away or the family that lives far away, have them on the phone actually when you go to the appointments, and so they feel sort of part of it and they're on the same page. That can be very helpful. So, the information is coming straight from the clinical team and it's not being passed on from one person to the other. That can be helpful.
Great. And I want to check in with Shari, our patient advocate, to see if she's experienced anything like that or has any thoughts about patients who are experiencing friends and family more being in denial and not wanting to talk about the cancer.
Well, most of the friends that I had before I came to Florida are in touch once in a while. I think they don't know what to say to me. And maybe they weren't really friends to begin with. I do have a couple of people down here. My lifelong friend lives about 20 minutes away. I talk to her all the time and see her quite often. And then we have rekindled a friendship that my husband had when he was a teenager. So we see them. The most important friends in my life at this point are my warriors at Gilda's. It's just amazing how close we have all become. And those are friends who really know what's going on. And they're here no matter what. They don't care if I have makeup on or, if I look like a slob. They're my friends.
Thank you, Shari.
Sure.
For our next question, we actually had several people write in who are both dealing with cancer and a second chronic illness. One said they were dealing with both melanoma and rheumatoid arthritis. Another said that they are fighting lung cancer and MS at the same time. Clearly, it's hard dealing with both. One person actually said, I feel like no one would want someone like me who's fighting both of these chronic illnesses at the same time. Stacey, do you have any advice for somebody who's dealing with cancer and a second chronic illness?
Actually, that's not that as uncommon as you might think. Many people come to cancer with a previous diagnosis, and it does complicate things, and it makes it seem even more unfair. But you're still you, and it's really important to surround yourself with positive people that accept you for who you are, and that and if you are a person with cancer and a person with MS, that's who you are. And there's somebody that will, and many somebodies that will want to be your friend, that will want to be with you. But if you're feeling so badly about yourself, I think that's kind of more would be my concern. Is if you're feeling undeserving of love, of friendship, because of your condition, then I think that's really something that would be important to talk about.
Thank you, Stacey. Dr. Robinson, do you have anything to add from your point of view?
Yeah, I have to echo Stacey, because if you think the number one, factor in having a cancer diagnosis is normally age. It's a disease of aging. And as we all age, there's many other common diseases that come along, diabetes, arthritis you mentioned, cardiac issues. So quite often we call them comorbid. It just means that you have more than one major diagnosis, and we do see that quite a bit. I think part of it is reaching out wherever you can. There might be an arthritis group in your area, diabetes group if there isn't a cancer group, but start trying to find the place where you do feel welcome. And if you don't know and you don't try, then you won't know the answer. So maybe you will feel not comfortable in one area, but again, try different places, different providers, different types of things, different types of hobbies that don't take too much energy from you, and eventually you'll find a place for you. And there are so many wonderful people and wonderful experiences outside of cancer, outside of the diagnosis, and sometimes it's just leaving yourself open to finding them. And that's easier said than done, I understand that, but I can't tell you the number of times people have come to our groups here and said, I wish I'd have come sooner, or I never thought that I would enjoy coming to chemotherapy because they got involved in one of our art groups during chemotherapy. So you don't know until you just, take that breath and take the step.
Thank you. The next question is, any tips as to how to deal with recurrences? Shari, if you don't mind, I'm going to ask you to answer this first, since you're dealing with the recurrence of cancer.
Okay. I just know that my cancer is never going to go away. It's an aggressive cancer, and it's very unusual to cure it. They can control it, and that's about it. So that's why when I talked about anxiety, I said that I can't help but think that since I haven't had chemo in a couple of months, that it's running rampant in my body. But it's just a fact of life for me. I feel as though once I have cancer, I will always have cancer, and I can't let it control me anymore. It did for a long time. It's my new normal. I'm just trying to get my life back. On my iPhone, my ringtone is that song, this is my, what is it? You see, this is Chemo Brain. I have a ringtone.
This is my fight song. Is it this is my fight song?
That's it, the fight song. Thank you.
You're welcome.
And when I hear it, it just makes me realize that every day is a fight. I'm trying to live my life as normally as possible. I used to cook a lot and bake. When I got sick, I just stopped. My husband did all the cooking, and he didn't bake, though. But he did cooking and shopping, and, he took over for me. Now I'm starting to cook again. I'm just trying to, step by step, get back to where I once was before the cancer. And it's probably going to take a very long time, but I'm doing the best I can.
Thanks, Shari. Stacey, do you have anything
Sure.
to add to that?
You know, this was a topic of our support group yesterday, was the recurrences, and it's every cancer patient's fear. Even while they're going through treatment for the first time, you know, the fear of what if it doesn't get it all, or what if it comes back. And I think that's normal. You know, to have that concern, but if it's overtaking your thoughts and overtaking your life, you know, then that's something that might need, you know, to be addressed. Of course, you know, nobody wants to have a recurrence, but what we're seeing now are that cancer has been classified as a chronic disease. It's no longer classified as a terminal disease, and that medication management has become a real thing, and that people are living longer and people are living well with recurrences. And as Shari just mentioned, you know, she's getting back to cooking. She's trying to do some of those things that she used to like to do, and she's doing some of those new things that she found that make her happy now. And so it's all about that new normal. It's all about it.
Thank you, Stacey. One question that we got, I don't know if the person is actually called in right now because we got this in advance, but this person asked, why do I feel so emotional and suicidal at the same time? Dr. Robinson, can you talk to this person's question and talk about if you feel if you have suicidal thoughts or feel suicidal, what you should be doing, what you should be thinking about?
Yeah, what we know is that suicidal thoughts, they occur. They are part of many people's experience of cancer, because you're facing a life-threatening disease. You don't know what that's going to entail. You don't know what the treatment's like, so you can get this extreme fear and not wanting to face it, not wanting your family to see you go through that treatment, feeling very isolated. So suicidal thoughts are actually, they are fairly common. What's not common is when you start to put it together and then just start to have a plan to start to make those, put some actions into place. Then that's sort of the red flag. I really need to get help because it's gone that step further, where it's gone to that major depression and into that sort of severe area, and you really do need some extra help to get through those very, very powerful emotions. So when you start to have them, that's the time, just to talk to people. Talk to the clinical team. They're always going to be the best bet. Tell them, I've been having these thoughts. Don't keep them to yourself and think that they'll go away, because if you're starting to come up with a plan, then you need to reach out to someone. And know that cancer is not defining who you are, and that's the biggest thing that I've learned since being involved in cancer care, is that it's just something that people are experiencing, and it doesn't define them. And there's still so much joy, and there's still so much life there, so many things that you can explore and discover about yourself and other people, even though you're facing this major life stressor.
Thank you. I'm afraid we've reached at the end of our time. I want to thank all of our participants for your enthusiasm and the questions that have made today's webinar a success. There were a few questions that weren't answered, and so when we email out to everyone who attended the slide deck and the link to the video of this webinar, we will also include answers to those few questions that we weren't able to get to. The Cancer Support Community Affiliate Network consists of 50 local affiliates, 50 local centers, Cancer Support Communities and Gilda's Club, in 180 locations and a growing number of healthcare partnerships. Please visit our website to find a local center near you to get the support that you need. And at this time, we'd like to let you know about our upcoming webinar, Frankly Speaking About Lung Cancer, What You Should Know. For more information or to register, please visit cancersupportcommunity.org/webinars. We would like to thank our wonderful panelists, Dr. Diane Robinson, Stacey Balkanski, and Shari Goldberg for contributing their time and sharing this important information with us. CSC would also like to thank our program supporter, Lilly Oncology. Please take a moment to complete our webinar evaluation survey, which you will be automatically redirected to. We greatly appreciate any feedback you may have. Thanks for your participation and have a great afternoon.
Thank you so much.